everyone. We're back with Ken Dombrowski, Executive Life Coach and Master Hypnotist, as well as our special guest, Michelle Dombrowski. And last week we had her on as a professional talking about her industry and fertility and infertility. But this week, I think it's important that we cover a different topic that she also has personal experience in lately, and that's going to be chronic pain. Do you want to just talk about that a little bit?
Sure. In December, I suffered from a fall. And since then have had a knee surgery, have had headaches every day, and have finger pain, been through some therapies and things like that. And I know what pain feels like now. I've never had this kind of pain in my life, and I have really had to lean on my husband here to help me through and guide me with his hypnosis, because I don't want to take any medicines. I don't want to put toxins in my body. I want to learn how I can better my pain.
And yes, that's been quite a challenge for us to work on together and overcome, because she's injured her knee, had a knee surgery, injured her finger, had lots of therapy on that, had a concussion. So there's a lot of pain throughout your body, and so it just kept on lingering, or as we say, chronic. Well, we want to look at chronic pain. It can come in a lot of different colors and flavors. That was a specific injury. A fall, actually sparking many injuries from that one fall. Also, people can come to us, they might have migraine headaches. Now, you don't have a migraine headache nonstop. It comes and goes. A person might have one migraine headache a week, or maybe one a month. That's still ongoing for many years. That's a form of chronic pain. And we all may have, I think most people might know of someone or heard of someone who has that phantom pain, it's usually going to be in the back, their back there's a severe amount of pain that the drugs can barely help, lots of treatments, lots of therapies, still can't ever figure out. They have exploratory surgeries and still can't find anything wrong. Well, when we see that, it becomes very clear that it's an emotional pain. So a lot of people might push back on this, but it's literally your mind putting pain there so then it can detect the pain. And why would it do that? Well, because it was a traumatic experience. So our mind, our subconscious mind, is always trying to remind us of pain that we've had because there was a trauma, so we can avoid that thing again. Mm-hmm. Or if a case of, say someone fell, had a severe back injury, like we're talking about a phantom back pain, and years later they still have all this pain. Well, it could also be their mind holding them back from doing more. The less I do, the less likely I'm going to have a tragic fall again. It can be how the subconscious is processing that. So now that we could talk about how you have these pain, yeah, you have actual injuries. There's going to be pain there, but it becomes chronic because of the emotions that's attached to it. So there can even be, a feeling sorry for yourself part of the pain. I can't believe this happened to me. Oh my gosh, I can't believe I'm the one who fell. It was embarrassing. Sorry, it was embarrassing for you to fall down in front of a bunch of people. And then you'll get to the hospital with a busted head and then all that. So there's an embarrassment factor there. Mm-hmm. And that can cause us more pain, as well as the injury itself. And then what we have is wonderful gift, and as human beings, we have this gift of habit. So the more we feel pain in a body part, then we become habitual about feeling that pain. So there's a lot of things going on at work, and so the only way to deal with this is not going to be more drugs and more surgery. It's going to be hypnosis. Hypnosis is the way to find it, reconcile with that pain, that traumatic experience, and then let it go. And then we do find that pain goes with it.
Mm-hmm.
Well, I think it's also important just because she always was a healthy person. She doesn't even get sick. You know what I mean? Mm-hmm. She's just not that kind of person. So I think it's also just like the stress of being in a situation that you're not usually in does a lot for it too, because the pain's very real. It's very there. But the stress of having to work around things that she's not worked around her entire life are causing issues as well. So we have a lot of discussions about how people think they're feeling pain and it's a medical thing, but it's actually not. This is the flip side of that. There is a medical reason. We know exactly what it is. There was a direct fall, and it's just the emotional fallout that comes with that physical pain. It's like that's why we have cancer patients. Clearly, there's a medical issue there that we need to discuss and we need to look at and pay mind to. But that doesn't stop your emotions from having feelings and getting in the way and making things, worse or possibly better when you add hypnosis.
Right.
Which is what's happening for you, correct? Like
Right.
the more that you calm down with conversations with him or hypnosis, it takes the stress away from it, correct?
Correct. Yeah. I think without having him with the hypnosis, I would be in a lot more pain, definitely. But it's helping, and I appreciate it very much.
My pleasure. Okay. Any other questions?
Look at her. She's the one with the pain.
Just one thing to add is that you have a fear of this happening again. You have a fear of falling again. You have a fear of embarrassing yourself again, and so hypnosis can help with that too, with those alleviate your fears and say you have to go back out into the world. You can't sit in your house all the time and sit on your couch and just wait for life to happen. You have to go and love your life. So that's where we come in here.
It's almost like you could say you should get off the couch.
Yes, exactly.
All right, thanks so much to both of you.
No,
Thank you.
If you have chronic pain that you would like to explore, give us a call today or visit our website. Thanks for watching.
Thank you.
Thank you.